There are several principles that you're going to want to have in place prior to starting a program with athletes. And within these principles, it's not only going to set your athletes up for success and help you create a more streamlined process for your programming, it's also going to make sure that you can adjust your programming in the future to make sure that they're continually making progress down the road. The first of these principles is a movement screening. What we're looking for here is to see how well an athlete moves in various body weight and mobility-based exercises. And all we're looking to see is how well they can perform the exercise through a full range of motion, and can they perform that exercise without any pain. If the athlete can perform the movement through a full range of motion, whatever it is, without any sort of discrepancies or any sort of issues, that athlete would pass that movement screening. Typically speaking, the movement screenings are graded on a 0 to 3 scale, 0 being a complete fail due to any sort of pain or discomfort when doing that exercise. If, for instance, the athlete is doing a squat with overhead reach and they experience a great deal of pain in the knee or in the hip, they're probably going to fail that movement and make sure that they are not going to load up that exercise in their training program. If they can perform the exercise but only through a partial range of motion, they would be graded a 1 or a 2. If there's a great deal of instability when performing the movement, so for example, if they're doing a push-up and they're shaking quite a bit while doing so, they would also only get a 1 or a 2. A 1 or a 2 means that the athlete can perform the exercise with a little bit of load in their training program, but you're really going to want to watch to make sure that they progress with technique in that exercise moving forward, and that they aren't loading it to be extremely forceful and explosive, but they're loading the movement just enough to be slow and controlled through the exercise and progress with their technique with the movement. So what I like to do is squat, push-up, hinge, and lunge exercises to represent what we should be doing in the weight room. If they struggle with any one of those 4 exercises, then you're probably not going to want to load them up with any sort of heavy weight with a squat, press, anything like that. Moving on from that, we can look to more mobility-based exercises. Upper extremity mobility, we'll be looking to see how well they can reach up behind the head, something like the Apley scratch test. Lower body, we're going to see how well they can actively raise their leg, how well they can go through some sort of a hip internal rotation and external rotation exercise. What we could also look at is T-spine rotation, how well they can rotate from the T-spine, and a lateral squat, see what their overall ability to get lateral and then move through that range of motion is. If they struggle with mobility in any of these areas, then you're probably going to want to directly address that, because that could be a limiting factor in their kinetic sequence, which I'll talk about in a little bit. Moving on from the initial movement screening though, what you're going to want to do is watch them move. Watch them move when they're jumping, sprinting, doing any sort of exercise in their warm-up or in their training setting. See how well they can jump and land. How well can they sprint, decelerate and change direction. How well do they respond when the load is increased on the movement. That's your main movement screening right there. And if you can see any sort of discrepancies in the way that they're moving when they are training, then you know what you need to address moving forward. And this is a continual process. It's not just about the initial movement screening. It's about continuously assessing how well that athlete is moving through their training sessions. And if you notice any sort of area where the athlete is struggling, then you know you can switch up the training method to match their needs. So for example, if you notice that the athlete struggles to get to depth with a squatting exercise when the movement gets above 200 pounds, with that extra load on top of the squatting movement, they struggle to get to depth. So what you're going to want to do then is train maybe an isometric maximal effort squat at the depth you wish to get the athlete to. And then from there, they should be able to do maybe something like a pin squat from the depth that you wish the athlete to get through, and hopefully they get stronger at that range of motion, and then you can increase the load from there. Moving on from that, you're going to want to take some sort of a sports kinematics analysis, some sort of way of making sure that your training is going to match up with what they're doing in the sport and what's most impactful for the sport. So for me, it's swinging and throwing. I look at the kinetic sequence of a swing and a throw as a series of muscle groups in charge of accelerating the movement and certain muscle groups in charge of decelerating that movement. So what does the kinetic sequence look like from a deceleration standpoint? With a throw, we see that front leg really have to take on a lot of force, a lot of eccentric force. That's a decelerator. That's a muscle group that is really trying to transfer energy up the kinetic chain. And then we see perhaps the hip extensors are moving extremely fast. That's an accelerator. That's a muscle group that's really trying to be forceful at very high speeds. So we can kind of look at the entire sequence as a series of these sort of links of the chain that are accelerating and decelerating up the chain. So what I like to make sure I'm doing is with those decelerator muscles, those muscle groups that have to be very stiff, I want to train those muscle groups to be able to handle a lot of excessive force through maximal effort, eccentric and isometric training. Things like Nordic hamstring curls and reverse Nordic curls are great for training the front leg bracing action, because we know that that front leg brace has a lot of eccentric forces placed upon it when we're throwing and swinging. Whereas the accelerator muscle groups, those muscle groups that have to contract very fast and produce a lot of rate of force development type movements, we want to make sure that we're training these with a lot of plyometric movement and concentric force type exercises. So for example, we know that the pec, when throwing and swinging, contracts very fast and very forcefully. So we're going to want to make sure that athletes can sort of press very explosively, perform a lot of plyometric push-ups and medicine ball chest passes and exercises like that for that muscle group. But now moving on to the last portion of the segment here of these principles, how can we determine if we should be training for more speed-based training or more heavy strength training? That's where a force velocity profile comes into play. What does the athlete's force velocity profile look like? You should have a good idea of how well they produce force when the load gets a little heavier or when the load is a little bit lighter. So what I like to do for a force velocity profile is take a 10, 6, and 2-pound medicine ball, have the athlete lie on their back and throw as hard as they possibly can. You can measure distance, or you can measure it into a radar gun, and it does a really good job of representing how well that athlete responds with that lighter load and how well they respond with that heavier load. If they are more force deficient, that means that they do not do very well with that heavier load, but they do pretty well with the lighter load. And then you're going to see that graph of that force velocity profile look a little bit more vertical. And if this is the case, then you're going to want to train with maybe a 70-30 ratio of strength to speed exercises and strength to speed reps in the weight room. So that means that 70% of your training should look like a lot of heavy strength training reps with maximal effort bench pressing, deadlifting, squatting, lat pull downs, and exercises like that. Whereas maybe only 30% of your training should be the explosive medicine ball chest passes, plyometrics, and sprints. Moving on from that, if you have a velocity deficient athlete or somebody who maybe performs very well with the heavy ball, but not very well with the lighter ball, and their graph looks a little bit more horizontal, where there's not a big difference between each load in their force velocity profile, you're going to want to do a lot more of the speed-based exercises, where you're doing something more of the speed-based routine, where it's a lot more like plyometric exercises, medicine ball chest passes, and you want to be tracking those movements, making sure that the athlete is improving in those movements. Probably about 60 to 70% of your training should be something power and speed based, where we're looking to improve in power with those exercises. And then you're doing just enough heavy strength training to ensure that the athlete is seeing good improvements overall in their